Hi everyone. Today during this presentation we are going to learn all about lung adenocarcinoma. We will discuss data, the biology of the cancer, and recent research findings. Lastly, I will focus on what we can do as a community to enhance patient outcomes. Lung adenocarcinoma is a kind of non-small cell lung cancer that develops on the granular cells on the outer part of the lungs, which produce mucus and other substances. This type of cancer is called adenocarcinoma. You may be wondering who is at risk for this type of cancer. Lung adenocarcinoma primarily affects smokers or former smokers, although it is also the most prevalent kind of lung cancer identified among non-smokers. It is more prevalent in women than men, and it is also known to arise in younger individuals than other types of lung cancer. There are a number of known risk factors for developing lung cancer. However, smoking tobacco is the most important risk factor for this type. Other risk factors include secondhand smoke, radon, which is a colorless odor caused by the natural decay of uranium in rocks and soils, occupational exposure to certain chemicals, outdoor air pollution, and personal or family history of lung cancer are also risk factors. Lung and bronchus cancer is the most common cancer in Canada. This is excluding non-melanoma skin cancers. It is the top cause of cancer-related death among women and men in Canada. According to the Canadian Cancer Society, it is estimated that in 2024, 32,100 Canadians will be diagnosed with lung and bronchial cancers. This accounts for 13% of all new cancer cases in 2024. Every day, an average of 88 Canadians is diagnosed with lung and bronchus cancer, and an average of 57 Canadians will die of lung and bronchus cancer. In the medical field, when cancer spreads throughout the body, it is called metastasizing. This is the spread of cancer cells from the place where they are first formed to the other parts of the body. In this case, lung adenocarcinoma can spread. Other cancers can spread to the lungs, but it is not the same as primary lung cancer, which is cancer that begins in the lungs. Lung metastasis occurs when cancer begins in another part of the body and spreads to the lungs. It's important to note that it is not treated the same way as primary lung cancer. Genetic mutations are alterations to your DNA sequence that occur during cell division, which is when your cells replicate themselves. Your DNA is what tells your body how to function. The epidermal growth factor receptor is a prominent driver gene in lung cancer. EGFR mutation frequency is significantly lower in lung squamous carcinoma than in lung adenocarcinoma. The EGFR signaling system regulates physiological activities such as cell growth, proliferation, and differentiation. However, with EGFR mutation, the signaling pathway is continuously active, preventing the death of tumor cells, leading to abnormal proliferation and eventually causing tumor growth. A genetic mutation is a change to a gene's DNA sequence to produce something different, such as allowing uncontrolled cell replication or cell death. Picture a society with regular people following the rules. Now picture a bad guy. We call him Tim. He does not follow society's rules and does what he wants. For example, he's supposed to wait for the crosswalk symbol before crossing the road. Tim will cross in front of traffic at any time, causing a disruption in society. Treatment options will depend on many factors, including the stage of cancer. Some options include surgery, radiation therapy, chemotherapy, immunotherapy, or targeted therapy. Stage 4 non-small cell lung cancer is the most difficult cancer to treat since it spread to distant locations throughout the body. In search of a study that focuses on treatments, I came across a study in which they identified YKT6, which is a gene that regulates the flow of protein traffic to various compartments within the cell, as a possible prognostic and diagnostic biomarker in lung adenocarcinoma. Patients with lung adenocarcinoma have a less favorable outcome when their YKT6 expression is elevated. For the diagnosis and prognosis of lung adenocarcinoma, YKT6 may be a novel biomarker. In lung cancer cells, YKT6 suppression reflected an increased apoptosis and decreased cell migration, invasion, and proliferation. In conclusion, this investigation thoroughly revealed that YKT6 may be an effective biomarker for both diagnosis and prognosis in lung adenocarcinoma. Lung cancer is a significant worldwide health problem. Treating lung adenocarcinoma remains a challenge due to a lack of early identification and poor therapy outcomes. Some evidence-based practice gaps that has the potential to improve patient outcomes include delays in prompt diagnosis and referral, underutilization of curative and palliative treatments, and the impact of older age and comorbidities on treatment use. According to the Canadian Cancer Society, it is recommended that if you're between the age 55 and 74 and presently or previously smoked tobacco, you should get a low-dose CT scan to screen for lung cancer every 3 years. Thank you for listening to my presentation, and I hope you've learned something about lung adenocarcinoma.